Now, globally, excessive blood loss is the number one cause of maternal mortality, and a huge proportion of deaths during pregnancy and childbirth happen in Africa. Now, researchers behind a study in Niger that managed to more than halve the number of women who bleed to death during childbirth are hoping that their groundbreaking work could be a game changer, particularly for developing countries.
Because the midwife hadn't been trained, I took over and performed the intrauterine procedure, and the bleeding stopped. Completely. It's huge. It really is a great technique, and it's easy to do. I am so happy about it.
So the treatment is low cost but has an enormous life-saving impact. For more on this, I'm joined now by Dr. Zeidou Alassoum, who worked on the study for the NGO Health and Development International. Doctor, thanks so much for speaking to us. Now, first of all, congratulations. Can you give us a sense of how big the problem of birth-related maternal deaths is in developing countries?
Hi, thank you. The problem of maternal death during birth in developing countries is a huge problem, and it's a persistent problem also. Not that the percentage of women who die during childbirth varies from 30 to 45% in our developing countries. But in addition to that, we know that in our country, in general, the health coverage is low. So even the number of women who attend health facilities to give birth, this number is low, and so many women stay at home to give birth. And when they give birth, and if in any case they have to bleed, they will bleed there and die at home. Also, even among those who give birth at health facilities, it's not always that we have the possibilities to save them, because we used to give them oxytocin immediately after birth, but sometimes we have in very remote areas where the cold chain that is needed for oxytocin is not available, or also we have rupture of this oxytocin. So in many countries we face this problem, and people need to take precaution to get a solution to that.
What was changed in your approach over the 6 years of the study that you did, and what were the most exciting aspects of your results?
In fact, we developed a strategy here with the government of Niger via the Ministry of Health. We put in place a strategy which aimed to prevent first and measure blood loss, and in case blood loss arrive, treat them either with oxytocin if it is available in health facilities, or what we call the misoprostol, which is now known by everybody. Okay, in case oxytocin is not available, or in case it's available but because of cold chain issue, this is no longer useful. Okay, we also take in account a very important aspect, which is to also involve the community by giving to women who we receive at prenatal consultation in the third trimester of pregnancy, to give a prevention dose of misoprostol to take with her at home, and we also invite them to come back to give birth with the tablet. The problem is that whatever we do, whatever effort we deploy to avoid the home birth, the women who decide in their interior that they will give birth at home, they will stay to give birth at home. But we are not inciting them to stay. We told them to come back, and if in any case in their road to the health facility, the baby arrives, then they take the misoprostol tablet as a prevention and continue their road to the health facility. As soon as they come to the health facility, Okay, in case the woman did not give birth on the road, then the nurse or the midwife take the tablet and do the injection of oxytocin.
Dr.
Okay.
Zeidou
Yeah.
Alassoum, congratulations on the breakthrough of the study. We wish you the very best of luck in trying to scale that up to make a huge difference in the dangers and risks faced by women giving birth, particularly in developing countries. Dr. Zeidou Alassoum there speaking to me from Niger.